Health news now at 5:47. Could you be at risk of an eye stroke? A lot of people have never even heard of this problem.
Yeah, but your cell phone might actually help you realize you're having one. Channel 2 Sofia Ojeda joins us now with what we need to know. Good morning.
Good morning. Yeah, I've never heard of an eye stroke. Lots of folks haven't, but it's pretty serious. It can lead to blindness. While staring at your phone screen in the dark won't necessarily cause the eye stroke, it could make the symptoms more noticeable. If you're on your phone and notice blind spots or distorted vision, usually in just one eye, it's a sign you need to get to a doctor and fast.
Patients with an eye stroke can either have partial or complete blindness. So it can be half your vision or a quarter of your vision, or it can be the whole thing.
Dr. Andrew Lee is chairman of the ophthalmology department at Houston Methodist Hospital. He says eye strokes cut off the blood supply to the optic nerve or to the retina, and symptoms can be immediate. The scary part is that you won't know right away whether the loss of vision is temporary or permanent.
In this case, an eye stroke patient would say they lose their vision for minutes and then it comes back. So that's analogous to a transient ischemic attack, which we call a TIA. So a TIA in your brain, you might get transient difficulty with speech or swallowing or moving your arm or leg. But a TIA in the eye is going to be characterized by loss of vision in the affected eye. So patients who have a TIA of the eye have transient vision loss. If you have occlusion, it doesn't come back.
Dr. Lee says although he doesn't believe there's an increase in eye strokes, they are diagnosing them more often because people are noticing something is wrong, particularly when they are using their cell phones.
Using the phone doesn't cause a stroke. It can make the symptom more noticeable because you notice it more because you're checking each eye. But really the risk factors are in the patient, not in their phone.
Okay, so what puts you at risk for an eye stroke? High blood pressure, diabetes, heart problems, clotting disorders. Dr. Lee says eye strokes can be life-threatening if you have any of these symptoms: partial vision loss or complete blindness. Get to the emergency room right away because an eye stroke can actually lead to a brain stroke, which is, they're all very serious and they're life-threatening. So get to the hospital immediately.
Wow.
It's scary.
It's really scary just thinking about that.
Yeah, definitely. So if you notice any of those symptoms, don't take any chances.
You want to leave that one unchecked at all.
For sure.